تأخذنا الحكاية إلى حلم الطفولة وقوة الإيمان في تلك المرحلة الحبلى بكل ما هو صادق وحقيقي ونبيل وجريء. بدأ هذا الطبيب العالم وترعرع في مدينة الدون كيشوت الفارس النبيل حسب رواية سيرفانتس العالمية. كان الدون كيشوت فارساً حالماً لم يحقق حلمه، لكن فارسنا النبيل شغوفاً بأحد الأطباء الذي كان يعالج الناس بإنسانية وعطاء ونبل. كان ذلك الطبيب يعالج الناس بعيادته التي هي قسم من بيته بهدف تلبية حاجات المريض في أي وقت. وقد تغلغل هذا النبل في تكوين فارسنا وأسهم في نجاحه وشغفه الدائم بالعلم والعطاء، وهو اليوم بحكم نجاحه كأحد أهم أطباء النسائية والأطفال الأنابيب في العالم، ولأنه يعلم كم أهمية الاستقرار والقرب من المرضى بما يعكسه على النتائج الأفضل، قرر أن يأتي إلى الإمارات وتحديداً إلى مدينة العين التي أرادها أن تكون مركزاً لتطبيق كل ما حصل عليه من علم وخبرة. وسط هذا الاستقرار المتاح إلى أهلها وزوارها والقاطنين فيها، هذا الفارس المعطاء يشعر بأن مهمته الرئيسية الآن هي المساهمة في صنع الحياة والحفاظ عليها هنا في العين، ليحقق بسخاء مجال أطفال الأنابيب وإدخال أحدث التكنولوجيا في العالم لتحقيق هذه النتائج. وها هو اليوم يضيف تكنولوجيا فحص الجنين غير الجراحي إلى هذه المدينة المحظوظة. رحبوا معي بالدكتور براوليو بيرامو، وكان لنا معه الحوار التالي. Welcome with me Dr. Braulio Peramo from Ain Fertility Center to talk about a new technology they are launching it today about the non-invasive prenatal testing. So you're welcome, doctor, and hopefully you can introduce yourself before.
Hi, thank you very much for coming to our clinic. My name is Dr. Braulio Peramo. I'm OBGYN and reproductive endocrinology consultant and medical director for Ain Fertility Center.
Okay, doctor, is it the first time to introduce this technology in the Arab region?
Yes, in fact, this is the first time that this technology has been set up and implemented and performed 100% locally in the region. There are some other tests, similar tests using similar technology available, but the samples are sent abroad to be processed in the labs, most in Europe and the States and China.
People are always asking of the side effects of any new technology. Is it having any new side effects?
The good thing of this technique is that as a screening test, it's just a test we perform in blood. So there are no side effects. There are no side effects for the technique. It's just a screening test. So all we need to perform the test is a blood sample from the mother, and that's it. So there are no side effects, and that doesn't do any harm.
What is the main benefits for the patient coming from this test?
The test is named Non-Invasive Prenatal Test. Non-invasive means that we don't have to go to take cells from the fetus, which is an invasive test, like amniocentesis, for example. You have to go with a needle into the fetus to collect some fluid and then to analyze these cells, right? This is invasive, because you are invading the fetus. With the non-invasive, as a prenatal test, we can do it as early as on the 10th week of gestation, right? So this is the earliest genetic test, non-invasive genetics test that we can do, because there are some other tests like the chorial CDS, the biopsy of the chorion, which can be done earlier than the 10th week, but it is invasive. You have to go and then to take some pieces of tissues from inside, and then it is linked to a risk of miscarriage. This test, again, has no side effect, no risks at all, and provides a very accurate diagnostic, a very accurate diagnostic on the. Yes, and the accuracy of the test is 99.1%, so it's very, very high. Means that most of times when the test says that the baby doesn't have any a chromosomal abnormality and is not having a Down syndrome, the baby is normal. And on the other side, when the test says that the baby is having a Down syndrome, the accuracy is very high. And most of times, this positive is a real positive, it's not a false positive. So the benefits for the patients are several benefits. First, the patient can have the screening very early in pregnancy, as on the 10th week, right? So that the diagnostic is coming in 1 week more or less, and then you know, or the lady knows. They may, of course, the test is intended as a screening. So depending on the outcome, you need to have the advice from with an invasive test like amniocentesis. Right? Usually we do this double check to make sure and to confirm the diagnostic. And then later on, the action, as you said, or the decision depends it's up to the couple what to do. But many times it is very good when there's a fetal abnormality. It is very good to know it beforehand, before the baby is born. Why? Because if the fetus has, for example, cardiopathy, a malformation in the heart or something, exactly, you can prepare everything when the baby is born to provide the best health care for him, so that survival, his chances of survival are very high. Okay, so this is one hand. So early, with the test, we have a very early detection of chromosomal abnormalities. First, second, as I said, is non-invasive. Third, the turnaround time, the time in which we have the report, is very, very short. It's like 1 week. And fourth, the accuracy of the test is very high in comparison with the traditional screening. Nowadays, most of pregnant women are screened with a combination of several serum markers in blood and the scan. So these tests, traditional screening tests, triple screening or quadruple screening, the accuracy that they have is not higher than 85%. Whereas the NIPT, the test we are doing here, the accuracy is 99.1%, so it's very much higher. And if we talk about the false positive, what is a false positive? A false positive is when you have a test which is saying that you have a disease when you are healthy, right? When you are adult. This is a false positive. Yes, exactly. So false positive with traditional screening is ranging between 4 to 6%, whereas with this NIPT test, the false positives are less than 0.9%, so very, very low. So that means that the test is very accurate, and with this we can reduce the need of unnecessary invasive tests later on for pregnant women.
Thank you so much for your time and your efforts, and we wish you the best for these great achievements and for the whole patients in the Arab region and Ain especially, or Emirates.
Thank you very much. It's always a pleasure to collaborate with your wonderful magazine. Thank you.